This time,
You're a stinker.
Dr. Michelle Oakley is on the road,
Hello, little friend.
where baby owls have their own armed guards.
Watch out, guys. Above. Oh, it's okay. Whoa, oh, heads up.
And the dogs are part wolf,
Oh, well, was a bit of a warning there.
with mysterious ailments.
He's so scared, he's just like trembling all over.
But it's a 500-pound boar that won't give in without a fight.
Mom,
Early summer has hit the Yukon. Dr. Oakley is at her home clinic
Oh, you're heating in here.
with vet tech Tracy and daughter Sierra. Today, they're meeting two very special dogs,
watch out. Good boy.
Ushki and Rocky.
So today I'm seeing Ushki. His owner, Maggie, she's concerned about Ushki having some funny colored urine. He's a fantastic family pet, but he's also a service dog for Maggie's son, David.
So where is Sissy's?
Inside.
Only one way to find out.
David has Hurler syndrome, which is a really rare genetic condition. He basically doesn't produce an enzyme that breaks down carbohydrates at all. Green light.
Ushki not only gives David physical and mental support, but he's also helping to train Rocky to take his place by David's side.
How many speed was that?
That was 75 miles per hour.
I gotta check.
You got to check. Oh. The dogs help. I think they help me as much as they help him, but the fact that they help him is a huge help to me because it's no picnic having a medically fragile kid.
Hi, Maggie. How's it going?
Hi.
How are you? Come on in. It's gonna rain.
Maggie and David really rely on these dogs.
Oh, David, what's your new dog's name?
Rocky.
Rocky. Hi. Rocky has leopard spots.
Service dogs are trained to be in tune to their people's needs.
Ooh, kisses. Oh, on the lips. We just met.
When they're sick, not like they can just go rest in a corner. They've got people who are really depending on them.
There you go. Good boy. What a good boy. Come on. That's a big jump. I don't know. Whoa. You are so athletic. My
Not like
goodness.
a hospital bed. I think he's fine.
Oh, right. So does he go to the hospital with
Yeah.
you and you take David and he goes? That's awesome.
Yeah.
And so is he basically there for support then, like kind of moral support?
He alerts for pain, overexertion. I didn't teach him that.
And how does he alert? Like he kind of...
At first it was barking, or sometimes he'll run back and forth between like whoever's responsible for David and
Yeah.
David, like, hey, check him,
Incredible.
something's going on. Yeah.
Incredible. Oh, man, Ushki.
Ushki's been formally working as a service dog about 5 years now. He actually has caught all kinds of things. He caught
Really?
trigger finger 8 months ago. David's fingers
Whoa.
are moving. I don't know how he knows that's not voluntary, but I
Really?
saw it happen 3 weeks ago. We already have a surgery date.
Oh, my God.
He actually was a family pet. He was 2 when David was born, and I think he knew before we did that something was going on with him. He always was quick to come and comfort him.
It's okay, Iski.
But they've just had the sweetest bond. I can't imagine doing the last 5 years without Ushki.
You are just sensitive to it all, aren't
Yeah.
you? You don't want anyone to be uncomfortable.
If Ushki can teach Rocky how to pick up on all those little changes in David's body that we've seen, I think that's that more than that part, you know.
Okay, so what's going on with this bloody urine? Let me hear a bit about how that's been going.
So it was a little while after we took him swimming last week, and I just kind of periodically check from time to time, and it was super dark. And the sample that I got is
Dark
a really funky
pea or
color. It was
red?
dark red, like towards the end.
Oh,
like,
okay.
I have the sample in the cooler.
Well, I'd like to see that when, if we can hold on him if you want to grab it.
The color and clarity of Ushki's urine could hold important clues to what's making him sick.
Ooh, okay. Yeah, that's really brown. Huh, doesn't smell very nice, doesn't look real nice. So, we're gonna hang tight on this.
A normal urine sample is usually pale yellow, clear. Ushki's sample is quite a dark color. It actually looks like there's blood in it, and that can be a sign that there's something more serious going on.
Can you hold that down leg above the elbow?
Good boy, Ushki.
This one, that's good there. That's a good boy. That's a good boy. Oh my goodness, what the heck? It's okay. It's okay. It's okay. You need to get down, love. I know you're worried. Aw.
So the first thing we're gonna do is an ultrasound of Ushki's bladder.
What does he have to do? Does he have to hold still?
Yes, okay. Stay still.
I wanna look to see if there's any masses, if there's any crystal-y kind of material.
So there's a lot of stuff in the bladder. So do you see that? The black circle at the top?
Yeah.
There's a lot of stuff in there that shouldn't be there.
I can actually see a mass, but I also see a little bit of crystal-y formation in the urine. Is it a bladder tumor, which can be very serious, or a kidney stone?
That's so white, it looks stone-ish to me. You know what I mean? Like,
Let's hope it'd be better than
yeah,
the alternative.
that would sure be awesome. Okay, everybody hold steady. Okay, we're gonna go in. Hold still, Ushki.
Using the ultrasound to guide, a needle is inserted directly into Ushki's bladder.
So we're taking the urine sample right out of Ushki's bladder.
Oh, I got the teeniest bit. Perfect. The teeniest.
The nice thing about that is you get your best sample and chance to get good cells that could be looked at by the specialist.
Okay, Ushki, sorry about this, but this is a good distraction.
A blood sample will also be sent to the lab.
Good boy, Ushki. Wait there.
Okay.
So I'm gonna send out the samples to a pathologist and see if we can get an answer on what's causing it.
Oh my goodness, that's so much better. Oh, you're such a good boy.
Good boy. All done. All done. All done. Yeah, I hope it's not cancer, but I know that's hard work, huh? You did good. There's generally like a dollar limit on what I would spend on a vet bill, but he's earned some extra grace there, so.
We'll talk about results as soon as we get those back
Okay.
on the blood and the urine, okay? And we'll make a plan from there.
Okay.
All right.
Thank you.
All right, you have a safe trip back.
Mission
get us Frisbee,
5.
please.
Oh
David said he's his best friend, but he's more than that. I think. You too? You know, he's been a protector. He's been he just helps with everything, really. We really got lucky.
Ushki's test results will be back in about a week. Until then, he'll continue training Rocky to be David's service dog. From special dogs to rare hogs, Michelle heads to a family farm that raises and sells heritage pigs.
Look, they're here.
Her daughter Maya and vet tech Tracy are here to help.
Hello. Today we're at Frozen Oak Farms, and we're going to be removing the fighting tusks, the fighting teeth on a couple boars.
We have a registered Duroc boar, and then we have a Mongolica. Have you ever heard of a Mongolica?
I've heard of them, seen pictures.
You wanna see 'em?
I'd love to,
All right,
yeah.
come
I've
on
never
in.
seen one in person.
We have a super rare breed of pig called the Mongolica. They're a Hungarian pig. They come from Hungary. We are the first one in Alaska to get these pigs up here. People know them as woolly pigs.
Rain's family relies on his herd of heritage pigs. And the herd relies on two special boars,
Whoa, holy moly.
Hans and Francis.
Look at that wool. That's
Isn't that something?
amazing. Let me feel that. Oh, sorry, did I goose ya? Oh, it's coarse, hey?
Look at that.
Oh, yeah. Oh, wow, that would be incredibly warm. Maybe not soft enough for like long underwear.
No.
Little scratchy,
But it's wool.
warm.
I mean, it's wool just like a
Yeah,
sheep.
that's so neat.
So-
Mangalitas are so funny. They look like a pig in a little sweater.
Their coats may be fluffy, but their pairs of fighting tusks are anything but.
I can't see their tusks yet, but I'm assuming they're big.
Yeah, they're big. He slit his ham right open with that tusk, so it's razor sharp. He's healed up pretty good now, but
Yeah.
when he did that, I figured we'd call you out and get those tusks
Yeah.
removed. So.
Yep. So these guys are in the same pen, but as they're getting older and it's becoming breeding time, they're definitely going to start fighting more and more. One has already put a big slice into the ham of the other, but if we just file off those really sharp tusks, they won't hurt each other. Do you guys have a hog snare for like holding them fast?
We do, right on the back wall
Good.
there.
That way we don't have to use drugs, and it's really tough to sedate these guys. It's much better if we can just restrain him.
Okay.
So I saw
So-
you had a squeeze out here too.
we set up the squeeze scale and got it all
Yes.
set up.
Okay, great. The first boar we're gonna work on is Hans, and he's the Mangalitsa with the woolly curly hair. It's not a painful procedure at all to remove the tusks, but of course it feels funny, and they've got something in their mouth and they don't like it. Let the pig wrestling begin.
All right. Can you grab that board right there?
Oh, a pig board. You even have pig boards.
Maya, if you want to put your pig board right there.
So in order to restrain him, we're gonna put him in the squeeze chute. We're gonna use what's called a hog snare, and it's basically just a loop that you slip it in their mouth and you tighten it. And it's not about like hurting them, it's just about holding them. And as soon as they feel the pressure on their snout, most of them give up and stand there like, because they don't like to be held. Even if you just held them, they'd scream. So that lets me get in there and file the teeth and get everything done that we need to do without having to wrestle him, without having to sedate him, which is a higher risk procedure for him. Back up there, buddy. Rain has a great setup, but even with all the safety measures in place, we still have to be really careful. Here now, what do you think? Even with a snare, these big boars are so strong, they can just pull it out of your hands if they want to. Snug. Whoop. Oh, watch yourself, watch yourself.
There, hand it to me.
That snare popped right out of the chute.
And that's why you always have to have your eyes open. Yeah, a little bit further back. And then once you get it, pull it forward.
I think we're good.
Yeah, that's my buddy.
Hans is finally secure and ready to see the dentist.
So now, let's see what you got there, buddy. Getting the tooth off is not that hard, but it is physical. I basically just have to slip a little bit of a giggly wire, which is kind of a very small saw wire, around the tooth. Open your mouth, buddy, and let me get in there. A few quick pulls, and it should be right off. Those are like sharp, so I do not want to get my fingers in there.
Boar tusks grow constantly and are perfectly designed for slashing and stabbing at their breeding competition.
Okay. So we'll try the other side now. So the tusks are actually a very long canine tooth that's kind of curling back. So you can see he has two big canines there. They rub against each other, and you can see that one there is like razor sharp. At the level of the gum where we're gonna remove it, it doesn't have any feeling. So we're just gonna take the tip off of it so that it's not that razor sharp. Okay.
Wow.
And there you go. So you can see razor sharp edge to it. And that's what's causing the damage when he's in breeding mode. Whew, okay. And you can see if you look back here, there's no bleeding. It's not painful to remove these. You were so good, I'm sorry to bug you. So Hans did great, but he's not impressed with being told to do what he didn't want to do. But once we released him, he was very forgiving and just walked back to his pen, very mellow. Oh my God, he's so cute.
Oh, you did really good.
Yeah, he did great.
I'm shocked.
Yeah, I don't know if the Derek will be that easygoing.
I think we're gonna hear some screams.
Yep. So now we're gonna do pig number 2. He's a Derek.
Come on, hup. Good boy. Hup.
They are generally not as easygoing as Mangalitsa's.
Duroc boars can weigh over 600 pounds, nearly twice the size of a Mangalitsa.
This is the one that we used last time, and he bent it, so just heads up.
Okay.
And they're known to push that weight around.
Whew. He's a big boy.
Yeah. All right, get ready for screams.
And watch yourself for that thing flying out.
Yeah.
So
Ooh, look at that.
he's
Barely
already
fits.
worked up, yeah. This Duroc boar is super strong. I mean, one kind of flick of the boar's head and someone could get sliced wide open. Yep. Okay, buddy.
Holy, his are like shark teeth.
Mom!
Michelle is face to face with a 500-pound Duroc boar with razor-sharp tusks that need to be trimmed.
Mom! I know it doesn't hurt. I know that pigs scream, but it's still unsettling. So we've got him trapped now. He doesn't like it. We just gotta get our job done, and the screaming won't stop till we're done. These tusks are incredibly sharp, and one kind of flick of the boar's head and someone could get sliced wide open. And even as I'm placing the wire, I have to really watch because I know he can move his head. And if he just moves it, he could take my finger clean off. I really don't want to get sewed up today.
One down.
Sorry, buddy. See how that looks? So you can see it looks fine. We got that one off. Next one.
What's this? That's his tooth. Really sharp, hey?
Isn't that cool, Raina? Okay, there's that one. Let's see what this looks like. All right. We're all done.
Good? Okay, I'm gonna let him.
Poor love. Oh.
All right, we'll let him out the front.
Yeah.
All right, come on.
Are you looking for that tooth? Yep. Aw.
With their fighting teeth removed, Hans and Francis can spar with less risk of injury.
Just mad. Just so mad. He's like, what am I gonna fight with now?
Well, that is going to save us a big vet bill when they don't scrape
Yeah.
up and cut up the other
It will.
the girls during breeding season. So
Yep,
thank you.
I think so. No problem. Yep, I forgot my earplugs. That was like the one thing you should have when you come to work on pigs, and I forgot them. We're all finished up here, but it was great to work with Rain, to see his pigs, and I got to work on my first Mangalitsa pig.
It's a new day in a new city. But the menagerie of unique animals continues. Michelle is in Calgary, home to over 1 million people and animals from around the world.
Sierra and I've come to Calgary this week to work at a few different wildlife facilities. I've spent a lot of time here over the last few years, so it'll be really good to catch up with old friends and also to show Sierra some really cool different facilities and for her to get some new experiences.
First stop, a sanctuary for dogs with a wild side.
Today we're at the Yamnuska Wolf Dog Sanctuary. Hi, Georgina.
Hi, Michelle.
It's a place where wolf dogs can come and live out their lives. In certain provinces and states, the wolf dogs are actually allowed to be kept as pets. But it's not good for the animal in a lot of these situations. You end up with a lot of issues of an animal that's going crazy in surroundings that it shouldn't be in. A lot of misinterpreted aggression. It just has more to do with their instincts that they're following. So how many animals are here?
Basically, there's 17 wolf dogs on site right now, and then we've got our oldest wolf dog who just needs a checkup.
Okay, cool. Let's go check it out.
Sure. The problem with wolf dogs is that they really are not able to fit into our domesticated companion animal dog world, and they definitely also cannot fit into the wild wolf surviving in the forest world. And before the sanctuary really existed, unfortunately, a lot of these wolf dogs ended up being euthanized or dropped off at shelters that would end up euthanizing them as well. So we think Rocky's about 13 years old.
Okay, and he's been having some difficulty with his legs?
He's got a bit of a tremor in his legs. We're just not really sure.
Oh, okay.
Rocky was rescued 1.5 years ago from an abusive backyard breeder.
So come on in. Hello. This is Rocky here.
Oh. Yes, oh, he didn't like that smell.
Do you have enough of that?
We have Angie, who is Rocky's favorite handler.
I see Rocky and the other wolf dogs in there. You know, at first you're wondering about, is it, aggression? And then you see them moving around and it's nervous, it's fear. It's this wolf side of the spectrum, which is to absolutely avoid people at all costs. He certainly has the hip movements of an older dog, kind of like the stiffness.
We've kind of noticed just the change in his movements, and just his overall kind of personality has changed a little bit. He's a little bit less patient and less tolerant of certain things, and so we're not really sure.
Right, yeah. So seeing how timid Rocky was when I came in, everything I'm gonna do it really slowly. So what's the safest way to examine him, do you think?
Yeah, so I think what we'll do is we'll end up putting him on leash, and then we'll take it from there.
Okay, sounds good.
Hi, Rocky. What a good boy.
He's afraid, and I'm, making him afraid. So it's kind of making sure that I don't cross that line and that this physical exam is a positive experience for him. And as much as possible, we just keep his fear and everything as low as we can and still get the job done. Could I try getting him?
Oh, for sure, yeah.
What do you think? Oh, wow, okay.
He can come in a bit quick sometimes.
Yeah. Good boy. So you're not looking that bad. I'm just trying to sneak a feel of his lymph nodes. Just feeling his thyroid now. But we're just gonna go really slow. Yes, that's sore. Hey, no, we don't like that. Sorry. Could I try a treat?
Yes, you can.
I have to get in there and try and touch him.
Sorry.
And move sore parts of him, and he doesn't want any part of that.
That's a good boy.
Oh, well, was a bit of a warning there.
Yeah, I thought so. He doesn't want to come at me at all, but he's definitely going to defend himself. So it's a very tough situation. It's pretty tough to do this, I think, without a sedation or of some kind. I mean, I really need to kind of dig deep and feel everything. I don't know if you're prepared to sedate him. It's kind of a higher risk procedure for an older guy.
I could try and just have him distracted and...
Angie, I think if you're gonna full on restrain him, then I would want to muzzle him.
I was thinking that too.
Well, then if you guys are comfortable muzzling him, then I think that's what we should do. It looks awful, you hate to put him through it, but often we use a muzzle in the clinic, not because we think the dog's gonna bite us. It's certainly a possibility, it certainly prevents that, but it's also a great distraction. So the muzzle is our best friend here. What a good boy.
We know you're smart, Rock.
Whoa. He makes me a little nervous every time he goes for those treats, but...
Michelle is at Yamnuska Wolf Dog Sanctuary, trying to get close to Rocky, a wolf dog with a tremor.
Was a bit of a warning there.
I need to get closer and I need to touch Rocky, and he's not into it. Gotta get a muzzle on him, and it's not gonna be easy.
What a good boy.
We know you're smart, Rock. It's okay. You're okay.
I got him.
Okay. So we'll just go slow.
It's sad. He's so scared. He's just like trembling all over.
Yeah. It's okay. So I want to feel these trembly legs now, okay? Okay, leg number 1. So I'm just trying to put his joints through a range of motion. His elbow is super stiff. Let me feel the shoulder, okay? Good. Oh, you're being awesome. Ooh, crunch.
So as I'm moving his arm, and basically his elbow especially, you know, it doesn't want to move to the full extension for sure. And as you move it, there's kind of crunching and popping. So that's called crepitus.
So he's got arthritis in multiple joints. His elbow, his shoulder, and I'm guessing even up high in the vertebrae, just from the trembling.
Yeah.
And it's amazing you're just noticing it now, because that probably has been developing for a year or two.
Right.
Instead of that nice smooth joint surface, it's a bunch of nasty bony arthritis and lack of cartilage, and that's just, and so you can actually feel that and sometimes even hear it.
Oh, you're being so amazing. You're being so good, bud.
We'd love to give him some medication for arthritis, something long-term to help him with pain, to slow down the arthritis as well. But because of Rocky's age, to do that, we really need to check in on the organs that are going to be constantly processing that medication every day, the kidneys and the liver. So to do that, we need a blood sample.
Okay, so here, do you want to let go and then hold off right there? Yep, pinch it. Good boy.
I was really impressed. Not only was he super brave throughout, even though we knew he was nervous, he kind of just held his ground and was okay with it.
Good boy. Oh, that was stressful. He's like, oh, I don't know if I want a treat after that. Get me out of here.
He was forgiving afterwards, and that was really cool.
So we can get the blood dropped off to IDEXX probably by tomorrow morning.
We got to get the results back on the blood, and then we can make a long-term plan. That will help guide us in what type of medication we can use for his arthritis.
Clean bill of health for you, Rocky. We just want to get you moving around more. What a good boy. Oh, he was so brave.
Hey, Rocky, I think you're ready to get to be free again, hey, bud? There you go. Good boy.
Good boy.
You know, there are certainly wonderful people who have wolf dogs. I cannot deny that, but it takes a really special person.
Bye, Rocky.
And unfortunately, there's a whole lot of people and a whole lot of dogs that situation does not work for, and the animal's the one that suffers. And it was really inspiring to see how much passion that Georgina and Angie are putting into the wolf dogs here at the sanctuary.
Michelle's Calgary rounds continue. Next stop, Discovery Wildlife Park.
Discovery Wildlife Park is basically a home for wildlife that have been confiscated, that were held illegally as pets, for surplus zoo animals, and they can all come here and live out the rest of their days.
Oh my goodness, what is going on here?
Burgley, look who's here.
Serena is the head keeper here, and she has me come out to work on some of the animals that need a little bit extra vet care.
Serena, I'm happy to see you, but who is this?
This is Berkeley. Just come sit. If she comes to you, let her come to you.
You are a stinker. You are a grizzly bear, aren't you?
Berkeley is a Kodiak bear cub, and she came from a zoo that didn't have the capacity to raise a bear cub, so they sent her here.
Berkeley! Come on, baby bear!
Oh, my lordy.
It's really exciting for Sarah and Michelle to come.
It's okay, Berkey. They're scary monsters. Oh, it's okay, they're scary monsters. I got you.
You know, with Michelle's vet experience, she's such a knowledgeable vet, so such a strong benefit to have somebody like that to be able to work with them.
Thank you for sharing her with us.
Always.
With the day's dose of cute animals done, Michelle heads to her first patient. Kumar, the park's only camel, needs to be neutered.
Is he a spitter?
I've never seen him do it yet. I mean, I'm not
Okay.
gonna promise, because you probably aren't gonna do nice things.
No, I would deserve it.
Kumar is a 4-year-old adult male Bactrian camel. That means he's got 2 humps. They are a domestic camel, but they are still pretty wild if they're not handled, and you do have to be careful around them.
Kumar is adapted to captive life until breeding season. Then his wild camel instincts take over.
They get a little bit more aggressive because in the wild, you have to compete for those ladies. And because we're not in the wild, we are in captivity, sometimes that aggression just gets transferred to people.
Neutering will make Kumar easier to handle through the entire year, but it's not without risk.
Safety is probably your biggest concern working with a camel. When they get mad, they can kick in kind of any direction, not just back, but even forward and up. And, you know, even a glancing blow could really hurt somebody. Are we ready?
We're ready when you are.
First step, sedate Kumar.
Serena's able to feed Kumar and get him close to the fence. So I'm gonna have her lure him close, and then I'm gonna use a stick pole to give him the injection.
Hi, Kumar. Hey, buddy.
Oh, man, that's nice. Good boy.
The stick pole went amazing. Sometimes they get super angry, and he basically was like, what? So now we just need to give him some quiet time to go lay down.
Oh, Kumar, do not go up the hill.
There's this nice hill in the middle of a pen, and of course, it'd be easy for him to roll one way or the other down the hill.
Oh, Kumar, go down and stay down, buddy.
He's way too big to move once he goes down, so that could be a problem.
So his head's down now.
I mean, approaching him, I have to always assume that he could jump up. So I'm gonna be ready with a top-up drug and with a towel to put over his head for a blindfold in case he is actually out. I'm gonna be really quiet, sneaking him from behind. I don't want him to get startled and try and get up and fall. He could hurt himself, or he could turn around and hurt me. You guys stay back here, stay back here. Kumar. As I approach, he's not moving at all. His head's down nicely. We're gonna go ahead and get him into position and get the procedure started. So the first thing I'm gonna do is have a feel of his backdoor biz and give him a block so that can have a few minutes to work. So camel scrotum actually sits out the back.
He's laying right on him.
Unfortunately, he's laying on like a hump of ground and on his leg, and basically I can't get at them to do the surgery.
Okay.
We're gonna need to tie his tail. He might even need to pull a leg forward because he's sitting right on him with all his weight. So we're gonna have to shift him a little bit. We're gonna have to move his leg out a bit and create a little bit of a space for me to do the surgery.
There. That'll give me some room.
Do we have any wipes?
Oh, that's better. Whoa, 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 everybody watch out.
That'll give me some room.
Kumar, the Discovery Wildlife Park's only camel, is aggressive and needs to be neutered.
Oh, that's better. Whoa, 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 everybody watch out. Everybody stand back a minute.
But he's waking up.
Is he moving on us?
Yeah. Kumar is starting to move, but I need him to be completely still during the surgery, so I'm gonna have to give him a top-up. Sierra, I'm giving him the top-up now.
Ready? Let's try this over a bit.
Kumar is now fully sedate, but his testicles are still trapped under his body.
Kumar is a big boy. He's probably around 1,400 pounds. He's not the easiest to move.
Sierra, come help us.
The longer Kumar is down, the more gas his ruminant stomach produces. If he can't release it, he'll bloat, and that could be fatal.
Right on top of her, buddy.
Michelle will need to work fast.
Hang on. Hang on, I can do it like this, actually. So we've manipulated his leg so that I can actually get my hands in there and actually find the scrotum. It gives us a little bit more room, but it's not gonna be ideal.
I'll just stay here,
Okay.
if that works for you.
Yep. I've got Serena kind of holding his leg in a good position, and I'm gonna be working a little bit blind,
Thinking cap. Thinking cap.
but it's the best we're gonna get, and so we're gonna get started.
Scrub-a-dub-dub. 2 camel humps in a tub.
It's gonna be a bit by see and a bit by feel here. To do a castration is actually pretty straightforward. It's basically just opening the scrotum, popping out the testicle. You put on the emasculator that will crush all the vessels that go back into the body. Tie it off, cut it off, you're all done.
I'm gonna cut right here. Serena, is there any way you can get your hand under here and push them forward while I'm doing this?
You see my hand?
No.
Well, I pushed a knacker forward.
No, that's his penis.
Oh, well then I'll...
Okay, go back up, back up.
Back up.
This is a lot harder than a castration should be.
It's trying to run away from me.
I can't quite see where her hand is and where the end of the scrotum is.
Oh, where'd it go? Wait now. Where'd it go?
So I have to be careful not to cut her.
I'm cutting.
And just to focus and cut on what I'm supposed to be, which is the 2 testicles underneath Kumar.
There we go. Yes! We have a testicle.
So I've got the first testicle out. It can't disappear from me. I'm not letting go for dear life.
Thank you. Nut to nut. That's a nut.
I'm gonna put the emasculator on now. It does a cut and a crush. It holds on to the tissue that's closest to the body and crushes that.
Holy.
Ooh, that sounded gnarly.
Ugh. Okay.
And I'm gonna leave that there for a good 7 minutes.
Nice. That's a big one.
First testicle's gone.
Okay, so I'll tie that off.
If the vessel's open after surgery, Kumar could bleed and require more risky sedation. Michelle ties a suture to be safe.
All right, so I'm gonna take this off and see what we got. It is not bleeding. Okay. So you don't have to hold anything
I can
anymore.
let go
Yep.
for it?
Yep. So I'm just cutting the second testicle now.
Castrations are not complicated, but I've never had to do one on a camel by feel upside down.
He's just in such a cruddy position. He's at least cooperating. We got the testicle out. Oh my God. I've never been so happy to get my hand on a testicle. Okay. Oh, Lordy. I'm not fooling around now. We gotta get this sucker out and get him up. Number 2, camel hump number 2.
Kumar's been down for almost an hour.
Serena, are you comfortable giving penicillin?
Yep.
All that's left is to sew him up and give him an antibiotic.
I think we're about done, gang. And he's getting late, so we'll just watch everybody. He's starting to do some little movements. But if I can get away with this without topping him up. So I'm done with this part. You guys gave him his fluids, vaccines, penicillin.
Yep.
We're all finished, but we're not out of the woods until he's up.
I need a 20 ml syringe. I'm still hurrying because I don't want him to bloat. They definitely can start to get gassy. He's a little bit bloated, but not bad.
If Kumar's bloat continues, it could compress his lungs, making it impossible for him to breathe.
I'm gonna give it to him now. Okay, you guys ready? He's getting it now, everybody out. He's starting to move a bit.
Once he starts getting up, he could be really dangerous. I mean, he could get up and kick, and we don't want to be anywhere around him.
Okay, he's been reversed, so everybody out.
Hopefully he just kind of lays there for a while, because try to get up too soon, you could, pull something or strain something when he's flopping around.
So I'll touch base with you as soon as I'm done bear presentation.
Okay, sounds good.
Have fun with your talk.
All right.
He's moving his head now, so that's good. He's lifted up, but he's still lying down, which is nice. And you really don't know how long till he gets on his feet. But once he has his head up and is kind of controlling his head normally, then you're kind of out of the woods. Ooh, ooh. What's he doing? Oh, God. I'm gonna go. Kumar is trying to pick up his head, but he's not yet able to. So I want to get in there, make sure he's still in a good position, he's not bloating, but I have to be careful. He could easily just jump at me if I get too close.
Kumar can't release the gas building up inside. If he doesn't get help, his stomach could expand, compressing his lungs and slowly asphyxiating him.
He's a little bit bloated. Who feels strong and wants to get in there? Like, who feels like they could help me push?
I can help you push.
All right.
I've got to get him sitting upright and sternal. So it's going to be all hands on deck. It's risky, but we've got to get him in there in a good position.
He's a little bit bloated. Who feels strong and wants to get in there? Like, who feels like they could help me push?
I can help you push.
All right.
Michelle is at the Discovery Wildlife Park, where her neuter patient Kumar is struggling to come out of sedation.
But we gotta really stay back from his legs, but I don't think he can do anything right now.
It's risky to get up close to an animal this big when they're coming out of sedation, but if we don't get him in a good position sitting sternal, the bloating can become a serious emergency. It could kill him.
Oh, love, you're bloating. Watch he doesn't roll over and get you. Just watch he doesn't roll right over on you. There we go, good. Okay, everybody, back up. Maybe he'll just sit there.
With his head up, Kumar will be able to relieve the bloat on his own.
Oh my God, that's so cute. Doug is such a sweetheart.
We got Kumar into a good position. He's sitting sternal now. He's able to burp off all those gases. There's no more bloating issues. And I'm really glad we could get the crew in there to help. He's actually alert. He just couldn't get over.
Yeah.
Yeah, thanks, Doug. Awesome.
With Kumar recovering, Michelle's work at the Discovery Wildlife Park is done. It's a new day, and Michelle is at the Calgary Zoo.
Please keep hands and legs inside the vehicle. We're pulling into the aviary.
Michelle joins Doug, the zoo's lead vet, to help out some old friends.
We're short-staffed right now, and so it's great to have someone with Michelle's experience. She did an internship with us here many years ago and come back in and come home basically to help out.
Today, the newest great gray owl chicks are due for their first physical exam.
How many chicks do they have? 3?
Yeah, we have 3 chicks today. They just started to hop out of the nest, so it's important to get them.
Hi.
Hey,
Good morning.
how are they this morning?
They're good. Very, very
right
active.
here.
Yes. So we have a couple of fledglings right up here.
Whoa. The owl aviary is basically a big forest that's been enclosed. Those babies are big already.
Oh yeah, that's why we need to get them.
It's great for the owls. There's lots of trees for flying and moving around, but it's really tough for us when it's time to handle the owls or catch them for anything.
The moms have been swooping, so we want to protect our heads.
Okay.
So
I think there's talon marks on here,
Yes.
actually. Sounds good.
They're very protective of their young, so that's good.
Look at the stink eye the mom is giving
I know.
us.
The family is surrounding us.
Great gray owls are expert flyers, armed with sharp talons, evolved to impale prey. The chicks can't fly, but they're far from helpless.
Because even though they're babies, they've got big talons already.
Yes, and they know how to use them already.
Yeah. In order to give the owls their exams, there's a whole team led by Ingrid for just catching them.
Yeah, I need a hat.
So the keepers are going to go with nets and basically try to gently put the net over them and scoop them up.
You know why we wear them backwards? Because they come from the back.
They hit you in the back.
Oh, really?
Yeah.
Oh,
So
okay.
that's why they always nail this right here.
You should put eyes there, like on the back of your head.
Good idea.
The owlets are up in a tree, and you have to scoop them without being hit by the parents who are trying to protect them.
You had one sitting right behind you here.
Right above you. Yeah. Oh, here she comes.
Ingrid, there's one above you. Mom's right here.
While one person is scooping the chick with the net, there's another person with the net right there guarding that person because the parents will dive in with those talons and get you.
Nice job.
But you have to be careful grabbing the chick because they already have little knife-like talons and they can get you too.
There it is.
There we go. Oops.
Also,
Perfect.
It's definitely a process of safely catching the chicks, but also none of us getting hurt.
Hey, little kitty. Oh yeah.
2 owlets are caught at once.
You are super, super cute.
So the vets tag team, quickly working through the exams under the parents' watch.
Oh, watch out, guys.
Oh, hi. Aw, poor love. So when you're examining the chicks, it's basically a beak to talon exam.
So the heart sounds really good.
I mean, you're starting up high, looking at the eyes, looking in their ears.
Beautiful.
They're definitely molting and getting their adult feathers now. And you can see all these brand new baby feathers. That means it's full of vein and artery. Each one of those are blood feathers, so that's why we're being really careful about handling them.
The size of the ears are asymmetrical. So one sits down low and one sits up nice and high in these guys. And that allows them to have that 3-dimensional hearing.
Once we do a quick once-over, then we take them over for weights. Ooh, woo, bigger than we thought. We're gonna vaccinate them against West Nile virus. So I'm gonna put it in his pec muscles without him biting me, hopefully. Owls are very susceptible, and they certainly could die from getting that disease. And I'm gonna go to the other side of the keel and the other. There you go. So we've got 2 down, 1 to go, and the last one caught is always the hardest. It's the last one caught for a reason. Just watch, Mark, because they will still nail you with that on.
Okay.
It's keepers versus owls, and the owls are armed.
Watch out, guys. Above. Directly above our head right here. She's looking at you right now. They're gonna dive bomb you and hit you with their talons. Oh, it's okay. Whoa, heads up. Whoa, heads up.
One above the fledgling and one's over there.
Michelle is at the Calgary Zoo, where the last of 3 great gray owlets needs to be caught for its first physical exam. But its parents are on high alert.
Oh, it's okay. Whoa, heads up. Whoa, heads up. Whoa, that was close.
You okay, Ingrid?
The parents are really on edge. They're coming at us, and we just really need to handle these babies quickly and get them back into their environment and leave them alone. Oh, heads up.
Yeah, they're pretty amazing.
Can we have one of you guys on guard now?
Sure.
There we go. Nice job.
Nice.
Nice one, guys.
So we got the last guy.
Hey, little kitty.
We're gonna do a quick exam.
Starting to develop their pectoral muscles.
Yeah,
quite nicely,
yeah, already, yeah.
Oh, look in the mouth there. Beautiful.
Oh,
There we go.
Well, you're the feistiest of the three.
Okay.
The last one, it's always the feisty, sassy one. Give him his vaccines.
Okay.
They're looking great. These guys are really good. They've had their vaccines and they're ready to all go back to their parents. The parents and the helpers are dive bombing right now as we released them. Oh my gosh. Oh, so cute. Oh, make yourself look big. That's right, because you are tough. Oh, fluffy pants. They're so cute. I don't know how their parents stand it. The babies look great. A few ruffled feathers from the exam. They look like they're enforcing the sign. Please stay on the path, or else. Here come the mummies. But the parents are done with us being here. We need to just get out of their space.
Excellent. So I think
Good.
we'll head out.
Bye, fluffy pants. Thanks, guys.
The Owlets will need round 2 of their vaccines within a few weeks. The Calgary Menagerie is done, and the Oakleys head back west. Now, she's at the mobile clinic in Haines, Alaska.
Hello? Hey, Georgina. Good. How's Rocky doing? I was just talking to Georgina from the Yamnuska Wolf Dog Sanctuary, and she was giving me an update on Rocky. Oh, good. Okay. That's fantastic. And it's going well? When I first saw him, he was trembling and uncomfortable and in a lot of pain. And now he is doing so much better. I'm really relieved to hear it.
Look at you, handsome.
With the anti-inflammatory medication he's taking, he's so much more comfortable, more active, and he's gonna be able to live out his life at the center pain-free and a lot happier. Good, well, we'll stay in touch on that, okay? All right, good, you take care. Bye-bye. Awesome.
Rocky isn't the only one with the renewed pep in his step. Ushki is here with David and his father, Dan, for a follow-up.
Hi there, Ushki. How's he been doing? Good. Good, okay. Is it okay if I put him up on the table? All right, come here, Ushki, I'll scoop you up.
When he last saw Michelle, there was a mass in his bladder.
Kind of heavy.
He's getting pretty old.
Is he? Yeah. That's all right, Ushki, you good boy. Okay, let's have a real gentle feel here, Ushki. Yeah, so I still feel something there. Good stuff. Good boy.
Ushki's urine was sent to a lab to determine if the mass was cancer or stones.
So when Maggie brought him in a few weeks ago, I took a sample of urine right out of his bladder and we sent it in. And what we're hearing back is there was no definitive sign of cancer cells, which was really good. They won't say 100%, but the sample we sent didn't have any in it.
Yeah.
What we're seeing is most likely stones, so bladder stones that are causing the bleeding and the blood in his urine. Even though that doesn't sound so good, it's definitely the better of the two.
Yeah.
You know, stones, we can try to change his diet and get rid of them that way, and they actually have diets that will try and shrink those stones. So our treatment for now is gonna be to change his diet and give him things that will try and break down those stones and he can just urinate them out. That would be the best case scenario. Did Ushki go with you to the hospital?
Yeah.
Fantastic, and did he do okay?
I think so.
You think so?
David's a big part of Ushki, and Ushki's a big part of David. And I think David kind of understands. He sees that Ushki's doing better, too.
All right, well, thanks for bringing Ushki in.
Hey, you want to jump? Go ahead. Go ahead.
Good boy. He must be feeling better.
He is.
You know, you can see that Dan's relieved, too, that, you know, his boy is going to have his dog, and his dog's going to be there for him. We'll be in touch, okay? You let me know how he's doing. We'll see him in a couple months.
Okay. What do you say?
Thank you.
You're welcome. And you take good care of Ushki, okay, David? Yeah, good luck, guys. Bye, Ushki. You know, it's such an important relationship, and I'm so glad I could help them along with it.